Okay, let's unpack this. Imagine a horse, right? Magnificent animal, but suddenly facing a really critical eye injury. We're diving deep today into a topic that, well, it combines intense pain, rapid damage, and honestly a race against time. Equine iris prolapse. For this deep dive, you shared some incredibly detailed research, exploring everything from the basic biology to, emergency treatments and what happens after. Today, we're basically mining those pages for the absolute crucial insights so you'll truly get a handle on this serious condition.
Yeah, and what's fascinating here is just how quickly something so delicate can become, well, an urgent crisis. We'll be looking at the what, the how, and the why it matters of iris prolapse,
Yeah.
sort of connecting the dots on how vital immediate action really is for these animals. It's a stark reminder that in medicine, sometimes saving a part means sacrificing another. A bit of a surgical paradox, where preservation often begins with removal.
So let's start with the basics then. What exactly is an iris prolapse in a horse? We're talking about the iris, yeah. The colored part of the eye, actually pushing its way out through a defect. And this isn't just a scratch. The research calls it a full-thickness defect in the cornea. That sounds serious.
It is. And to connect this to the bigger picture, think of the cornea as like the clear front window of the eye. When there's a full thickness defect, a hole right through the aqueous humor, that fluid filling the front chamber, it starts to leak out. And that changes the pressure inside the eye, pushing the iris forward and, well, out. Suddenly it's no longer a closed, sterile system.
Right. And here's where it gets really serious, or maybe alarming is the better word. Once that iris tissue is exposed, it quickly becomes necrotic.
Hmm.
What does that actually mean for the horse, and why is that such a critical concern?
Necrotic means it dies. The delicate iris tissue dies really rapidly. And it's not just the initial injury, it's the sheer speed of it. It happens because of exposure to air, drying out desiccation, and immediate secondary infection. Environmental bacteria, fungi, they gain direct access right into the eye. That can lead to severe complications like endophthalmitis.
Which is inflammation and infection of the entire internal eye.
Exactly. And this always indicates severe inflammation of the anterior uvea, that crucial middle layer. So inflammation there is a major red flag for the eye's overall health.
Okay, wow. So what causes this critical situation? Is it always some big dramatic injury, or can it be, I don't know, more subtle sometimes?
Generally, iris prolapse is almost always a consequence of significant ocular trauma or pretty severe corneal disease. The papers outline two main pathways.
Okay, first, trauma. So we're talking sharp perforating corneal injuries, things like wire, branches maybe, or even blunt injuries causing rupture. But interestingly, the material suggests sharp insults might actually have a better prognosis than blunt ones. Why is that? That seems a bit counterintuitive.
It does seem that way, doesn't it? But think about blunt trauma. It can cause more widespread damage. Things like hythema, which is blood in the anterior chamber, and even globe rupture. Often that rupture happens at the limbus or the equator of the eye.
Those are the weaker spots.
Kind of like the eye's natural fault lines, yeah.
Mm.
Thinner, weaker points where the clear cornea meets the white sclera. It's a natural seam that can give way under blunt force. And secondly, and this is very common, it's due to perforated corneal ulcers.
Okay, so these aren't just surface scrapes.
No, definitely not. They're deep ulcers, often bacterial or fungal, that basically eat their way through all the corneal layers. Melting ulcers, sometimes called keratomalacia, are particularly dangerous because uncontrolled enzymes literally dissolve the corneal collagen, like really rapidly.
Right, melting. That's a vivid term. So it could be a foreign object penetrating, or maybe even a ruptured corneal stromal abscess. Essentially anything that creates that full thickness hole.
Pretty much. Any incident that creates that hole immediately puts the eye in crisis mode.
And once that happens, what are those initial urgent signals? The things you'd spot that just scream iris prolapse emergency.
Okay, let's step into the owner's shoes for a sec. Picture finding your horse and knowing something's wrong. Intense ocular pain is almost always present. You'd likely see severe blepharospasm, that's intense squinting, epiphora, which is excessive tearing, definitely sensitivity to light. And the horse would be really reluctant to let you examine it. But the hallmark sign, as noted in the research, is seeing a dark, often irregular mass protruding through a defect in the clear cornea.
And that dark mass is the iris itself.
That's the iris itself. Yeah, it can look brown, black, or even greenish black if it's already necrotic.
Okay. And other visual cues might include, like a visible hole, cloudiness around it.
Definitely. And an altered or distorted pupil shape is common. You might see blood inside the eye, that hyphema we mentioned. The eye might even look softer, maybe partially collapsed because it's lost fluid.
So once you spot these signs, what's the diagnostic process like for the vet when they arrive? It sounds painful to examine.
It is painful. So a thorough ophthalmic exam is crucial, but it absolutely requires sedation and local nerve blocks. You have to manage the pain to allow a proper inspection. Key procedures include, well, direct visualization, ideally under magnification,
Okay.
then a fluorescein stain. This dye pools in the defect, confirming there's a loss of integrity, a hole. There's even something called a cytal test, which can show active aqueous humor leakage. You see the dye streaming away.
Wow.
And critically important, especially for ulcers, is corneal cytology and culture sensitivity.
To figure out what bug you're dealing with.
Exactly. Identify the specific bacteria or fungi involved. But here's a vital point. Samples must be collected before applying any topical anesthetics or antibiotics.
Ah, that's a critical point. You need to know what you're fighting before you start applying treatments that could interfere with the test.
Precisely.
Is there anything else that helps the vet see deeper, or maybe things they specifically avoid doing during the exam?
Well, ocular ultrasound can be really helpful to assess deeper structures if the front of the eye is too cloudy or damaged to see through clearly. And critically, tonometry measuring intraocular pressure is not generally performed.
Why not? Seems like pressure would be relevant.
It is, but the risk of pressing on the eye and worsening the prolapse or causing further damage is just too high. Besides, you'd expect hypotony, low pressure anyway, because of the fluid leaking out.
Okay, makes sense. So this sounds like an emergency from the absolute moment it happens. The sources are very clear. Iris prolapse is a surgical emergency. Medical management alone isn't enough, right? It's just a holding action.
Exactly that. Medical management is primarily about stabilizing the eye until surgery can be performed. And referral to a veterinary ophthalmologist is highly recommended. You really need specialized skills for this. The immediate goals are just infection control, inflammation reduction, and pain relief.
My time.
You're buying time, exactly. But the clock is absolutely still ticking, especially for vision.
So before we even get to the operating table, what does that crucial pre-surgical care actually involve? What are they doing?
It's intensive stuff. We're talking systemic, like injections or oral meds, and topical broad-spectrum antibiotics, started immediately and applied really frequently to fight infection. Topical antifungals are often started empirically, too, meaning based on suspicion, especially in warmer climates, or if it looks like a melting ulcer just because fungal keratitis is so common.
Right.
Then, topical atropine. This helps relieve painful spasm in the ciliary body, part of the eye's focusing muscle, and it helps prevent adhesions, like scar tissue sticking things together. But a crucial point from the sources, horses getting atropine must be monitored very closely for colic because it can cause ileus.
Ileus.
Yeah.
Right, for listeners, that essentially means the gut stops moving, which is a massive and potentially life-threatening problem for horses.
Absolutely. It can quickly become life-threatening itself, so careful monitoring is key.
Okay, what else?
Then you've got systemic NSAIDs, non-steroidal anti-inflammatories like flunixin meglumin for pain and inflammation. And for those really nasty melting ulcers, anti-collagenase agents are used.
So these are specific enzyme blockers.
Yeah.
Designed to literally stop the cornea from dissolving further, like hitting the brakes on the melting process.
That's a good way to put it. They're like the chemical cavalry arriving to halt the meltdown. Examples include using the horse's own serum or plasma autologous serum or drugs like acetylcysteine and EDTA.
Okay, quite an arsenal just to get him stable for surgery.
Yeah.
So for the surgery itself, what's the key technique? How do they repair the cornea and handle that prolapsed iris tissue?
Well, the research really emphasizes that the prolapsed iris tissue is typically necrotic, dead, and contaminated. So it is almost always excised, meaning removed completely, rather than trying to push it back into the eye. Putting it back would likely just worsen the infection.
Okay, so removal is key there. Then what?
Then the corneal defect, the hole, is meticulously sutured closed under magnification. And a very common, really beneficial technique is to place an overlying conjunctival pedicle graft.
A graft. Okay, so describe that. It's like a patch.
Sort of. It's a flap of the conjunctiva, that thin tissue covering the white of the eye. It's carefully mobilized but kept attached at one end, so it still has its own blood supply. Then it's swung over and stitched across the corneal repair site.
Ah, so it's not just covering the hole. It's like
Right.
providing a strong living scaffold for the eye to rebuild itself, bringing its own blood supply right to the construction site.
Exactly. Think of it as bringing in reinforced concrete and a supply line all at once. It provides tectonic support, structural strength, brings in that new blood supply to help healing, and it protects the fragile repair site underneath.
Fascinating. It really sounds like a delicate dance, though, between saving the eye and trying to ensure no further complications arise from the surgery itself. But sometimes, despite all these efforts, the eye just, it can't be saved.
Unfortunately, yes. In really severe cases, extensive damage, uncontrolled infection that just won't quit. Or if there's clearly no potential for vision left, then enucleation, which is eye removal, may be the most humane and appropriate treatment.
Right, to alleviate the pain and prevent systemic infection spreading.
Exactly. Sometimes removal is the kindest option.
And assuming the surgery goes well and the eye is saved, the post-op care is just as intensive, I imagine.
Oh, absolutely. Aggressive topical and systemic medications, antibiotics, antifungals, anti-inflammatories continue for weeks, sometimes months. Plus, strict stall rest is crucial, and continued use of an eye cup or protective mask to prevent the horse from rubbing or causing self-trauma. Frequent re-examinations by the vet are absolutely critical. It's definitely a long road.
Okay, so after all of that, the injury, the diagnosis, the intensive treatment, the surgery, the long recovery, what's the long-term outlook? What can owners expect for a horse that's had iris prolapse? The studies, as you mentioned, differentiate between saving the globe, the eyeball itself, and saving vision, which is a really crucial distinction.
It really is. The prognosis for equine iris prolapse is generally considered guarded for vision, but often fair to good for globe survival if you have aggressive, timely, and appropriate treatment. But this raises that important question. What factors truly influence that outcome? And what does guarded for vision actually mean in practice for the horse?
Well, the research highlights time to treatment as the most critical factor. That seems pretty clear. The sooner the intervention, the better the chance. What about the specifics of the injury itself? Does that matter?
Definitely. The size and location of the defect matter a lot. Smaller defects, especially those the sources say are less than about 15 millimeters, tend to have a better prognosis. Traumatic lacerations, those sharp cuts, may have a slightly better prognosis than severe melting infectious ulcers. And fungal infections often carry a worse prognosis than bacterial ones that can be tougher to treat.
And if other parts of the eye are involved?
Yeah, involvement of other structures like the lens or the retina significantly worsens the visual prognosis. It becomes much more complicated. And something that's often overlooked, I think, is that while globe survival rates might sound okay, some studies suggest 60–80%, the real insight here is the quality of that survival. Meaning it's not just about keeping the eye in the socket, it's about what the horse can actually see with that eye afterward.
Right. So even a saved eye can effectively be a blind eye or have very limited vision. And complications can really derail things, even if the initial surgery seems successful.
Oh, absolutely. The development of endophthalmitis later on, or glaucoma, high-pressure chronic uveitis, cataracts forming, retinal detachment, any of these can significantly worsen the visual outcome long term. Also, a really key point from the research. A prolonged duration of ulcerative keratitis before the prolapse actually happened, especially if it was going on for over 2 weeks, that's directly linked to a poor visual outcome.
So the pre-existing condition matters too.
Hugely. It really turns the recovery into a long-term management challenge rather than just a simple fix.
It sounds like the chance of retaining useful vision then is definitely more guarded. Maybe, what, 30–50% based on some of those figures?
That's in the ballpark, yes. It varies a lot depending on the specifics, but useful vision is certainly not guaranteed.
And it's clearly not a cheap or easy journey for the owner.
No, and this raises an important point that practitioners often emphasize. Owner compliance and financial commitment are absolutely critical factors. The treatment is prolonged, it's intensive, it's expensive, and it requires significant dedication. Multiple medications multiple times a day for potentially months. And even with a saved globe, many horses will need long-term management for secondary complications like chronic inflammation or glaucoma.
So what does this all mean when we wrap it up? Our deep dive into equine iris prolapse, it really shows it's a profound ophthalmic emergency, no question. From that moment of injury through the diagnosis, the stabilization, the surgery, the intensive postoperative care, every single step feels like a race against time, against infection, and ultimately against vision loss.
Yeah, and knowledge is most valuable when it's understood and applied, right?
Right.
What's really clear from all this is that while saving the eye itself is often achievable with aggressive medical and surgical intervention, preserving useful vision, that's a much more challenging goal. It's heavily reliant on really prompt action and that specialized veterinary care.
It's definitely a powerful reminder of the fragility of even these large, strong animals and just the incredible complexity of veterinary medicine. So here's something for you, the listener, to maybe mull on. What similar race-against-time medical emergencies exist, maybe for other animals or even for humans? Situations where early detection and immediate specialized care make all the difference, but where maybe the long-term quality of life or function is really the true measure of success, not just survival. Something to think about.